Please let me know if you can see my screen.
Yes.
Yes, I can.
Are you all see my screen now?
Yes.
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 Okay, okay, thank you very much. All right, so we are going to be talking about prioritization now. So there's no actual topic called prioritization on the Nclex. I know most of you guys are about to write the examination, and some of us have already written. And let me just put it this way: most of us have not even had any idea or plans on writing the examination. So I'll try to make this lecture as simple as possible. But mind you, we'll not be covering all aspects of this topic today. So now, what do I want to tell you guys? Now, on the Nclex, if you are just new in this class, just a moment. You have different clients needs category on the Nclex, and this is one of the things Nclex actually tests you on. Using these four major categories, you have the safe and effective care environment, you have the health promotion and maintenance, you have the physiological integrity, you have the psychological integrity. Under the safe and effective care environment, we have management of care, we have safety and infection control. So management of care accounts for about 16 to 22% of questions that you see on your examination. So this question alone is like the largest when it comes to the most areas you see on your examination. So that's the highest area you're likely to see. So 16 to 22%. If you take some time to check other categories, you see they don't even get to this point. So about 16 to 22% of questions you see on your examination comes from this management of care. So there are a lot of topics that comes from this management of care, which is they test your delegation skills as a nurse, ethics. How do you prioritize? How do you make some clinical judgment? These are one of the areas that management of care captures. Do you understand? You have other categories like safety, infection control, and all those things. We're not going to be moving into them. And I just believe you all can see it, right? So these, okay, hold on, please. Let me just go back to that place. So you have the safety and infection control. That's another topic that talks about infection control, standard precautions, and all those things. Health promotion talks about maternity mostly. I'm just trying to narrow it down because there are a lot of things to say here. Physiological integrity cuts across some other subtopics like basic care and comfort, risk and reduction potential, pharmacology and parental therapies, and others as well. You can see there. Then psychological integrity cuts across coping, communication, and mental health questions, right? So, but our focus today is under management of care. So that is it. So now, talking about the management of care, I've told you some of the topics you're likely to see there, which is assignment, delegation. There are lots of them, right? There are lots of topics. But prioritization is one of the things that you're definitely going to see here. So they are testing your ability to prioritize care, to handle care independently in the hospital as a nurse, as a registered nurse. So that is prioritization for you. All right. So what is prioritization? I would have loved you guys to, explain. But let me even ask us, can anybody just tell me what you understand by prioritization? Let's make this class lively. Let's not dull everything. Yeah, let me not show us everything. This one, we don't need the Nclex to tell us what is the definition of prioritization. So everyone has what they understand by, everybody knows what they understand by prioritization. So can someone just tell me what they understand by prioritization? Anybody? Can you tell me, can anybody, what do you understand by prioritization, class? All right, Nurse Jessica, you raise your hand. Go ahead, please, Nurse Jessica.
Okay, in my own understanding, I would say prioritization. Can you hear me?
Yes.
Hello? Okay, in my own understanding, I would say prioritization is placing value regardless of having several
Mhm.
placing value
I didn't get
to
everything you
particular.
said. More.
I,
You said
I,
doing what?
I said prioritization refers to my own understanding. I would say it refers to placing value to a particular thing regardless of having several options.
Thank you very much. Placing value on a particular thing, regardless of having several other options. That's quite good. That's quite good. I like that. Thank you so much for that. All right. Okay. Okay. Now let's go ahead. Now you've defined prioritization for us. Let's see what the definition we have here. So prioritization is deciding which needs or problems require immediate action and which ones could delay in response until a later time because they are not urgent. So this is just a simple thing. Nurse Jessica actually gave us a wonderful description, right? So it's trying to decide which problems require an immediate action and which one can wait later. That's just a simple way we can put that. Are you guys with me? So let me know if you cannot see my screen very well. Let me know if I can zoom it up very well. Please let me know. Can you see my screen very well?
I can see it.
Okay, all right. So that's the definition of prioritization. Now let's look at the words. What are the words that could indicate your needs to prioritize on your examination? Let's look at the following words right here. You have the words like best, early, late, essential, first, highest priority, immediate, initial, most appropriate, most important, most likely, next, priority, or primary. I don't know if I think I've seen, okay, next is here, right? So these are some of the words that you would see that could indicate your need to prioritize. Do you understand? Most of the times, depending on the question bank you use, they can actually, bolding up those words so that your focus will be on it, right? All right. So let's look at one of the examples of what we have here. This is a classic priority question on the Nclex. Now you have one of the examples here. This example says, we're not trying to explore questions. I just want to give you an example of what the question looks like. Now, one of the example here says the nurse in the emergency department is caring for a client with diabetic ketoacidosis, DKA. That's what we know it for. After obtaining the client's blood glucose level, hold on. After assessing the client's blood glucose level, which prescription should the nurse implement first? Can you guys say that word? First. Can you say I highlighted it? So that is a classic what? Priority
Yeah.
equation. So when you see that, is one of the things that helps you know to know that this is a priority equation. So we have the options administer 0.9%, but we're not looking into this question yet. We will come back to this particular point. So let's just ignore the answer. I know it's tempting to attempt the answer, but let's just leave that for now, right? So let's go ahead. We have other things to talk about. Okay. Now let's look at what are the steps that we can actually use in making clinical judgments on the Nclex. What are the steps we can use? I have a table to show you guys, but one of the first things to do is try and understand the topic of your question. That's by making a content connection. Try to understand. Don't just jump. I know you've learned a lot of things before coming to this class. You've come across a lot of tutors and everything before coming to this class. Now, one of the things I would tell you is try as much as possible to make a content connection. Understand the topic of the question being tested. Do you understand? Then after understanding the topic, then you can, the step two is try to analyze a strategy and tips or principles you can use to carry out your elimination. Are you getting it? By understanding this second step, we help you to know your question. Is your question a priority question or is your question an evaluation question? Let me explain what I mean by that. Look at this picture. Look at this picture. I'm going to be explaining this thing. Can you also see this picture I'm showing you now?
Yes, we can.
Right. Okay. Thank you. So you can see the first step was to make a content connection. The second step is to understand the strategies to use. After going after the second step, then we can go into priority question. So this is my major focus for us today. I want us to talk about the priority action and the priority client. So these are the areas I want us to talk about. Priority question. I'm going to be explaining what that means. But before I jump into priority questions, these few steps you can see here, before I go under the steps right here, before I go here, let me explain something to you people first of all. Now, that content connection, let me break it down more so you guys can get what I'm talking about. What does content connection mean? Now, let's say I'm talking about this particular question now. The nurse in the emergency department is caring for a client with diabetic ketoacidosis. After obtaining the client's blood glucose level, which prescription should the nurse implement first? Now, what do I mean by understanding or making content connection? Remember, for you to excel in prioritizations on the Nclex, you need to, number one, you need to know your content. Yes, and you need to learn strategies. What we're actually doing today is focusing more on strategies, right? So there are other things that you can benefit if you join our academy fully, right? But I'm just trying to make you understand. So if I'm a candidate trying to understand this question, what can I get now before jumping into the options? Let's say you've not discussed or had this topic before, you've not read about this topic before, you just saw this question. what do you do? Try to understand what the patient is talking about. So to me, I can say the nurse in the emergency department is caring for a client with diabetes ketoacidosis, and you know that DKA is one of the medical emergencies you see on that patient who has type 1 diabetes, or even some cases of type 2 diabetes. Are you getting the point? Now, that's the point. They have given you the clue of the case of the patient. They have given you the diagnosis of the patient. A patient who has a client, an emergency department caring for a client with what? DKA. Now, after obtaining the client's blood glucose level, which prescription should the nurse implement first? What they are trying to make you now understand. If I'm a candidate, what I would do here is, okay, they are asking me about a patient who has DKA, they're asking me what prescription to implement first for a patient who has DKA after I've obtained the blood glucose level. So when you understand that you are caring for a patient in quote who has diabetic ketoacidosis, right? Understanding the topic and understanding everything that comes with their presentation, it should be running through your head. That's why content is very important. Now they're asking you, which prescription would you want to implement first? There are a lot of things to give, right? So this is me trying to understand my question without jumping straight into the options. Do you understand? I'm not even talking, I'm not coming to the options now. We'll come to the options later. So you have administered 0.9, let's leave those ones. We'll come back to it. So first one is to understand and make a content connection. So they're asking me, the examiner wants you to know what prescription would you anticipate for a patient who has diabetes or diabetic ketoacidosis. That's something you should have at the back of your mind first before trying to go into your options. After you understood this question, you should know that, oh, this question is basically a physiological question. That means it's not under those mental health kind of question. You're already narrowing down where you think your question is, right? So that's that point first. We'll come back to this question later, right? Let's continue. So we are in this table now. We're on this table now. So we've talked about step 1 and step 2. Now, let's talk about these key areas, priority questions. So talking about priority questions, you have what we call a priority action question, and you have what we call a priority client question. Now, nobody is asking you what is a priority question, what is a priority action question. These tools here have been designed to make your understanding of topics like this quite simple. Do you understand? Now, these tools or these strategies broken down here is to help you, make a good strategy in getting your right answer. Do you understand? All right. So now let's talk about what a priority action question is all about and what a priority client question is all about. Now, if you're conversant with Nclex questions, I want you to know that there are some questions that when you see them, hope you all can hear me. Please let me know if I get disconnected. There are some questions that when you see them, they are actually talking about the care of multiple patients. I don't know if you have seen all those kind of questions that will tell you, the nurse in the emergency, they'll tell you, the ICU nurse is, or the emergency nurse, it could be any actual nurse, but the main question is, which of these patients is the nurse going to see first? A patient who has this, that's option 1. A patient who has this, option 2. They will give you multiple patients in a question. That's what we call a priority client question. The one I talk about, priority action question, is mostly utilized when you have a single patient, just one patient. Are you getting it? Now, there are a lot of strategies to this, but I'm just trying to give us one of the simple things that will help us in breaking it down. So now let's talk more on the priority action question first. Let's talk more on that part. Let me display the next image to us so we can see. So now under the priority action question, when you say a classic priority action question, that means a single patient, just like the one we have here. This question is capturing only one patient. They didn't tell you multiple patients. They didn't ask about any multiple patients here. They're just asking you about one single patient. I get it. So most of the times we use this particular strategy or steps for answering this question. Are you guys with me? So moving on. Let's go. Now, I'm going to come back to this. Just hold on. Let's break it down. So now the first thing we have on this list, please don't forget this step. Don't forget this step. The first step here is what? Can you guys read it out for me? The first step here is what?
Assessment.
Assessment versus implementation.
Thank you very much. You guys on point. Assessment versus implementation. All right. Let's try to explore questions like this. Now, okay, let's look at this. Let's look at this question. Assessment. Let's look at this. Now let's read this question. There was a time I posted this question on our social media platform. If you're following us, you should see that. Maybe at the end of the class, we'll drop a link to that on the Telegram platform. Now let's look at this question. This question, let me read this question now. And I'm going to be assessing the step one, the step two, and the priority question. I'm going to explore those two now. Let's go. Now the nurse is preparing. I hope you all can read the question very well.
Yes.
All right.
Yes.
So the nurse trying to administer lisinopril 10 milligram and furosemide 20 milligram to a client. Now the client's blood pressure is 150 over 80 millimeter mercury. Now the client's serum potassium level is 5.2 milliequivalent per liter, and the serum sodium level is 136 milliequivalent. What action will the nurse take next? Can you guys picture this point? Can you see next? Can you see the point there? Next, you can see the point here. Hold on, I did not put it well. Let me put a
Yes.
better automation so you guys see it. So you guys can see this word nest, right? Thank God I've captured it now. Now, if you've seen this nest, it shows that this is a priority question. Now, what are the steps we're going to use? Now, remember the first thing I told you is to make a content connection. Try to understand what your question is driving towards first. Now, let me explain it now. Let me assume to be a candidate now. Now, I'm the nurse. I am preparing to administer lisinopril. What is lisinopril here, class? What's lisinopril? What drug is that for?
So,
Anti-hypertensive.
What?
Hypertension.
Anti-
Yes.
Yes, ACE inhibitor and angiotensin conversion. We all know that. Yes, an
yes.
ACE inhibitor medication. Yes, lisinopril, right? 10 milligram, or you can say antihypertensive. Even if you don't know all those things, I'm just trying to make this class as simple as possible. All right. So lisinopril, is an antihypertensive medication, 10 milligram, and furosemide. What is furosemide for?
Diuretic.
What's furosemide?
Diuretic.
Yes, it's a diuretic medication,
Diuretic.
right? 20 milligram to a patient, right? Yeah, we are getting to a point. Now, the client's blood pressure is 150. That means this patient is hypertensive, right? Are you seeing me making content connection? I'm trying to understand my topic. Now, the client's serum potassium level now is 5.2 milliequivalent. On the classic Nclex question, this is just for tutorial purposes. On the classic Nclex question, they will give you the normal range or the reference range for potassium. Are you getting it? They will give you the reference rate for potassium. The reference rate for potassium is 3.5 to 5.0 milliequivalent, right? So you have your patient who's having a potassium level of 5.2 milliequivalent, right? It was before, like 4 or 5 years ago, they don't usually give reference rate, but the recent updates allows them to give you a reference rate when it comes to laboratory investigation. So no need to panic. Yeah. So let me continue. Now, that is for the potassium level. Now, your sodium level is 136. Now, what is the normal reference range for sodium, please? What's the reference range for sodium, class? Can you guys tell me? Sorry, no, sorry.
135 to 145.
Thank you, Nozola Dejo. 135 to 145 milliequivalent, right? So you can see now they asked you. Now, the next question is what action will the nurse take next? Now, mind you, that means you are taking care of a patient who has a lesson, who is to receive. You have not given yet. Who is to receive lisinopril 10 milligram, and this same patient is to receive furosemide 20 milligram, right? For a patient who is hypertensive, blood pressure 150 over 89. Now, this patient's laboratory investigation states that their potassium level is high. That is, the normal range of potassium is 3.5 to 5.0. So having a patient who has 5.2 shows that the potassium level is what? High, isn't it? Now, the serum sodium level is what? 136. What range is our potassium, our sodium? Our sodium should be in the normal range, isn't it? 135 to 145, and it's 136 in this question. So our sodium is okay, isn't it? I want you
Yes.
guys to respond.
Yeah.
Now
Yes.
you've understood that. They're not asking you, they're tasting your clinical judgment. What action would you take next? I posted this question. Most people we are going for, I would like to administer medication I'm not even done making content connection. If you know your content, just like most of our candidates here, you understand that one of the things that Lisinopri does is, yes, Lisinopri is hypertension. I won't like to go so much deep because we have other things to explore. Lisinopri is, we call them RAS medication. Those running angiotensin those medications that acts under those that actually inhibits the conversion of this angiotensin. We call them RAS medication. I don't want to go so deep into it. So one of the things this medication does is that this medication is known to elevate potassium level. So lisinopril is going to be elevating potassium level. Sorry for that. Then furosemide, which is a diuretic, yes, is known to do what? One of the, if you know about diuretics very well, your diuretics actually reduce electrolyte level, isn't it? They'll reduce
potassium electrolyte wasting diuretics.
Level. Right? They can reduce potassium level, they can reduce sodium level, right? So you have these two medications to give now, and they are telling you something now. I'm trying to determine what to do now because I've understood that this patient is receiving lisinopril, this patient is receiving furosemide. Yes, let me tell you what furosemide can do. Furosemide can lower potassium. Furosemide can lower sodium. I'm telling you, furosemide can also, yes, it helps to do other things in the body, but let's just focus on what we have here. Let's not add or take out later about. Now, the first step is hold the lisinopril, notify the healthcare provider. Option number 2 is administer both medication. Option number 3 is obtain an ECG. Option number 4 is administer a potassium supplement along the medication. Now, what the thing we said first, we said after determining the equation, the making content connection, and because it's a single patient, we're trying to use that priority equation style, right? So we have assessment versus implementation. Now, assessment versus implementation is actually derived from the nursing process steps, right? If you know your nursing process, you have your assessment, you have your diagnosis, you have your implementation, you have all those outcome education and your evaluation, all those steps. We have all those things under your nursing process, right? So one of the things I want you guys to know here is now after you have understood your topic equation, now we are going to the first step, which is what assessment versus implementation. Let's read our option now. If you read this through, if you go through these options, there are options that actually has to do with actual implementation, and there are options that has to do with what assessment, right? So holding the lisinopril and notifying the healthcare provider, is that an assessment or an implementation? I want us to say the answer. Is that an assessment or implementation? Thank
Implementation.
you. Implementation. All right. So you can just write somewhere in your head, okay, this is an implementation. Option number 2, administering both medication. Is that an implementation or assessment?
Implementation.
Thank you very much.
Implementation.
Option number 3, obtaining an ECG. Is that an implementation or an assessment?
Assessment.
Thank you very much. Assessment. Option number 4, administering a potassium supplement along with the medication. Is that an implementation or assessment?
Implementation. Implementation.
It's an implementation. So how many assessment options do we have here?
Only one.
Okay. So when
One
it comes to this
assessment.
question, only one, and that's number 3. So if okay, all right, hold on, let me add something. Okay. All right. So now I have obtained my assessment. I've known that now number 3 is what? Number 3 is an assessment. I can eliminate number 3. Now I'm left with 1, 2, and 4. You are narrowing down your choices. Are you guys getting it? Are you seeing the point? Now, if you go back to this, hold on. If you go back to this, our strategy, after assessment, you have physiological and psychological. Are you guys seeing my screen? You have your physiological versus your, sorry, that thing is blocking the thing. Let me take it out. Sorry. Let me take it out. Let me erase other things. Yes. You have your physiological and psychological before we do our ABCs. Are you guys with me? Now.
Yes.
So this particular this is something you can do for every equation, but I'm trying to teach you guys step by step, gradually, right? I'm trying to make it down gradually. So now, if we go through all those process and we say, okay, now we've tried to eliminate the assessment option. We've eliminated option number 3. Now, you're left with option 1, option 2, option and option what? Option 4. The next one is physiological versus psychological. So when you say something is a physiological thing, physiological means is this. Okay, let me talk about the psychological. When you talk about something is a psychological problem, what does it tell you, class? Let me get a response. When you say something is a psychological thing, what do you think it is?
Being with the mind.
As a mental
Sorry,
base. As a mental base.
mental condition, right? Or psychological, emotional, all those things. Yes, that is a mental. You can just say it's emotional. I'm just trying to use simple words that we all know to make this very simple for us. All right. So now this is something you look at for. Then what is a physiological thing? What is a physiological thing? This is derived from Abraham Maslow hierarchy of human needs. Just for your information. So physiological, what are physiological needs? These are things. Okay, somebody should say something. Let the floor is open. What's the physiological problem?
Related to the body, like the physiological functions.
I didn't get you clearly. You can speak up very well.
It's physiological, like what the functions of the body.
It's to deal with the basic
All the
needs. The basic
I'm
needs
sorry.
that that
Hold on. Let me try to increase the volume from the side. Okay, basic needs. Okay, thank you. Yes, so we can put it this way. So physiological needs. Let's just let's just use the Abraham Maslow to make it very simple for us. Thank you, Nelson. Thank you, um, Masaluto Sili for that. Now, physiological needs are actually let's just use practical example. The patient needs a physical. Let's just say physical need like shelter. Let me not even go far. Oxygen, food, water, all those things. These are physical needs. I'm just trying to use simple terms. Let me not go so advanced. Let's just use that word. So one of the things you need to know, or the principle in the Nclex, is that physiological needs will always take priorities over psychological needs. If I have a patient, I have a special question to address that. So this particular question, no, none of the option contains any psychological points here. No, none of the option is a psychological point. For example, if you are reassuring a patient, reassurance is kind of a psychological intervention. So psychological option is nowhere to be found in this situation. So we can kick off those steps and we can move into our ABCs. Do you understand? Sometimes your options cannot contain ABC. I have a special question for that. So don't worry, I'm just trying to teach us step by step. But just to answer this question, now, after we've made our content connection, I told you guys that lisinopril does what? Lisinopril causes potassium elevation for a patient who already has hyperkalemia, that's elevated potassium level. Now, they're asking you, what action would you take? That brings us to our step 3. Our step 3 is talking about outcome. You're trying to talk about if the answer you're picking matches your topic, if it promotes the highest safety. Now, if I'm going to ask us which of these options gives our patients the highest safety need, the answer is number 1. Do you know why? Why is number 1? Is because holding lisinopril is a medication that elevates potassium level, and notifying the healthcare provider is very important. Do you see that they didn't stop us from giving furosemide? Most of you will go for option number 2. They will be like, if I give lisinopril is going to be elevating potassium, whereas furosemide is going to be reducing it. You're not promoting safety. You're just gambling with your patient's life. On the Nclex, in real life practice, you guys might do that, but when it comes to the Nclex, you have to just be very standard with every answer you're displaying or giving up. Are you getting it? So one of the best things that can promote the highest safety for your patient is by holding that medication that can elevate, then notifying the healthcare provider for that. You won't be giving the both medications. Giving both medication is like gambling. How much potassium do you think could be elevated? How much potassium do you think could be reduced by the furosemide? You cannot tell. Are you getting it? So we're not going to be going for assessments already because we have enough assessments to carry out an implementation in this particular question. That's why we're not going to be going with this point. Are you getting the point? Then administering a potassium supplement along with the medication, you can see this point is very wrong. Reason being that your patient already has what? An elevated potassium level. You can see it. The patient has an elevated potassium level here, and you can't be giving potassium supplements to someone who has hyperkalemia. That's, endangering your patient. So can you see why number one takes the highest priority? All right. Do you guys understand? Do you guys understand this point, class?
Yes.
Yes.
So there are other things, right? So let's just keep that in mind. Now, I'm just using this question. My main focus is to address the assessment and implementation, right? These are different steps you go through. Now, let's look at another question style that captures what I want to talk about, which is the physiological versus psychological points. Are you getting it? Now, different question. You have different forms of question on the Nclex, right? You have different forms of question, but I'm trying to use this question to capture some topics to bring your mind, narrow down your thinking to what we are discussing here. Let's read this question now. Now, the nurse is assessing a client who is 12 hours post-operative following a total thyroidectomy. Which of the following client finding is the priority for the nurse to address? Are you guys seeing that priority in that question? That tells you that this is a priority question, isn't it, class? You all can see it, right? Let me put it here. Hold
Yeah.
on.
Yes.
Let me clear
Yes.
it up and
Yes.
put it there. You can see the priority here. So that tells you that this is a priority question, right? Now,
Mm.
what's the first thing I told you to do? What's the first step? Who can remind me the first step I said? The first point. Who can remind me of the first point I made?
Assess- assessment
What?
versus implementation. Something. You said assessment
No,
versus
no, no. Before
implementation.
that,
Assessment with implementation.
whenever you
Okay.
see any new question, you should make a content connection. Just don't jump into the options. Try to
Connection.
understand the topic. You understand?
Okay.
Content connection. Thank you so much. Content connection. Now, you are in this question. Just put yourself in this question. You are the nurse. You are assessing a client who is 12 hours post-op following a total thyroidectomy. Which of the following client finding is the priority of the nurse address? So what comes to your mind? You are caring for a patient. We are caring for a post-op patient, not just a regular post-op patient. What was the reason for the surgery? Is a total thyroidectomy. So the thyroid gland class. Don't we know where the thyroid gland? Can you guys hear me, please? Hello.
Yes. Yes. Yes.
Slightly. All right. So now, okay, let me just hasten up to not waste time. So you're the nurse caring for a patient who is post-op total thyroidectomy. Which action or finding is the nurse going to address first? Now, option A is talking about the client is weeping silently and says, "I'm terrified that my voice will be ruined forever and I will never sound the same." Option two or B, the client refuses to look at the surgical dressing, stating, "I can't stand to see that. Sorry, I can't stand to see what they did to my neck." Option C says the client reports a dull aching pain at the surgical site, rated as a 6 on a scale of 0 to 10 scale. Option D, the client reports a new mild tingling sensation around the lips and in their fingers. Now, we have made content connection. Content connection is trying to understand that we are caring for a patient who just what who is 12 hours post-op thyroidectomy, right? So there are a lot of things that should come to your mind. So they're asking you which of the findings. So basically, the options you can definitely get here as the options here in this question is basically assessment. So are you saying that the first step after we have made our content connection, trying to strategize what to use, the first point is assessment versus implementation, right? So if you do assessment, you find out that all the options here are basically assessments, right? Already they said in your question, which of the following client findings is the priority? So your option is basically an assessment. So we're going to be jumping past that step. So let's go on to the next one, which is what? Physiological versus a what? A psychological point. So now, if I ask you guys, who Who can tell me which of the option is a psychological option? Which of the option contains a psychological point here?
A.
Which of the options? A. Thank you. I'm terrified that my voice will be ruined forever and I will never sound the same. That's a psychological point. Does any other option contain a psychological point here? Look very well. Oh.
B.
Any other option? Thank you. Your patient makes this
B.
statement. I can't stand to
B.
see what they did to my neck. Thank you. I can't stand to see what they did to my neck. That is a psychological option. Now, option 3 is what? What point does it cover?
Physiological.
Let's go gradually. Sorry?
Logical.
Physiological.
Physiological, yes.
Physiological.
Also psychological. Because most of the times, yes. Most of the times, pain on the Nclex, most of the times can be attributed as a psychological point. Not all types of pain. Now, there are types of pain that you see on the Nclex. You know that this one is indicative of a particular condition you don't joke with. Are you getting the point? So let's just attribute it as a psychological, or even if you don't get this point, don't worry. There are steps you go through that will help you. Even if you don't know how to apply the step 1, you don't know if it is assessment or implementation, and you progress to the next step, which is physiological versus psychological. Don't worry, you don't need to bother yourself, right? Now, we've made a content connection. We're actually under the physiological versus psychological. Now, I already know that what I should be doing is to eliminate any option that is a psychological point, because this question already is a physiological point. This question is addressing a physiological need. So because this question is addressing a physiological need, my answer should capture that. That's me making a content connection, right? Yes. Because they're asking you someone who did post-total directomy what to do, right? Or okay. Let me leave that. I think that's for the previous point. That's for the previous point. Let me let me see what I'm trying to say. Now, this question is talking about the findings. Let's focus on that. Findings you should prioritize. So because you're asking for findings, option 1 is a psychological point. Option 2 is a psychological point. I told you guys that psychological and physiological point is talking about somebody who has a pain on a rate of 6 to 10. A pain of 6 to 10 can be classified as a moderate to, yes, it can be classified as a moderate form of pain, right? Yes, it can be classified as a moderate form of pain. So your patient is having a moderate pain. Then option number D is talking about a client who reports a new mild tingling sensation around their lips and in their fingers. Now, this is your first time. You don't even know what this point means. Now, let me explain what this point means. That's why I told you, you need to know your content very well. If you know your content, to answer questions will be very easy for you. Yes, you need to know your content, master your content. Now, adaptomy, we are also taking out the parathyroid gland. Now, what is the function of the parathyroid gland, class? You can tell me. What's the function of the parathyroid gland?
Controls the level of
What's the
calcium.
function of the gland? Okay, it controls. Can you guys hear me? So I'm trying to switch because this is actually my laptop is actually delaying, so I just have to switch to my phone. Can you guys hear me? All right, you guys can hear me clearly, right?
Yes.
All right. So the function of the parathyroid gland is to regulate calcium level, right? So if you are taking out the thyroid gland, who can tell me what happens to the, if you are taking out the thyroid gland, what happens to your patient's calcium level? So you can hear me very good. What happens to your patient's calcium level? If you observe that, you know that your patient's calcium level is likely to
Reduced.
drop.
It will
Thank you. Your
decrease.
patient's calcium level is going to be decreased. So because your patient calcium level is going to be decreased, what are the things that are likely to be seen now? Your patient's calcium level is decreasing. You are going to be seeing muscle excitability. These are the things you see. Yes, you're going to be seeing muscle excitability. The cells are going to get so excited. Because the cells get so excited, you are going to see tingling sensation. It can be happening around, the leaves, your fingers. I know you guys have the classic symptoms of hypocalcemia, but there are other ways they can actually present these points. Are you guys getting the point? Yes. So your patient is going to be having mild or tingling sensations around their lips. If care is not taken, it can cause what we call laryngeal spasm. Are you getting the point? So, which of these points indicates most signs of impending doom? You can see it's option D rather. So, can you see why we are going to be prioritizing option D? Are you getting the point? I don't want to necessarily touch the last point, which is ABC, because if I go through the ABC, you will still understand why I'm trying to go to this point. So, if you get, I'm trying to break down each of these steps that I mentioned. I'm trying to break down each of these steps, starting from your assessment to your what, from your assessment to your physiological needs, down to your what, physiological needs, down to what, your ABCs. Do you guys understand? Let me clear this thing. It's blocking what I'm writing. Does anybody have any questions so far before we talk about the ABCs? Just have a few minutes to. I think I might just finish up this first part. Then I will give you guys the question on the platform to attest and to solve for it. I hope you guys are following class.
Yes.
All right, thank you very much. Now let's talk about the ABCs now. ABCs, I think that's one of the most popular things you must have had if you are preparing for your examination. Now, ABC stands for airway, breathing, and circulation, right? This is what it stands for, airway, breathing, circulation. Now, I'm going to be posting some things on the Telegram platform because I want to give us a question after that, right? I want to give you guys a question. So you can just minimize and go to your Telegram. I can still display that, but I would like you guys to, yes, I would like you guys to come to the Telegram platform. I'm going to be posting some things. Please, you don't need to call the call, just minimize on the Telegram platform. I'm going to be telling one of our instructors to post some things. Let me know if you are there. So just type hi. If you're there, just type hi. If you're there, just type hi. Let me know if you're there, class. If you're on the Telegram platform, you can just type hi. All right. I can just see one person. Yes. Yeah. Keep it coming, guys. Keep it coming. I want to talk about the last point. All right. Okay. I will still find a way to display this information. All right. Thank you. Thank you very much. Thank you very much. I can see the points, right? All right. So the last point is talking about your ABCs. Now, I want to forward something to you guys, and I'll still present that later on. I want to forward something to you guys. The ABCs. Just hold on. Let's look at this points. Let's talk about the ABCs. Hold on. So in the Telegram platform, you saw an image I forwarded right there. I want to give you guys a question after that. So your ABCs are the steps in which you prioritize. If you have gone through, because most of the times when candidates see this question, they can actually ignore those first steps I talked about, those assessment versus implementation, those physiological versus psychological needs. They are just faced with assessments. Yes. They are faced with ABCs rather. So your ABC is what? Airway, breathing, circulation. And this simple steps actually, they are arranged in their order of priority. So airways usually takes priority over breathing, and breathing takes priority mostly over circulation. Most of the times in emergency nursing, when we prioritize circulation is usually when we have uncontrollable breathing. Do you understand? But for the sake of this class, let's just stick with the ABCs because it's another topic on its own. Now, under the ABCs, you have airway, you have breathing, and you have circulation. What is an airway problem? An airway problem is any condition that actually causes a physical obstruction, or it can be a form of obstruction to your airway. Do you understand? So there are common conditions like choking, foreign body aspiration, inhalation injury. Inhalation injury is caused by burns to the, um, to the face or to the upper part of the body. Inhalation injury is when someone has a burn that actually affects their their airways. Now, other things can cause swelling in their airways and can impair flow of oxygen. So, another form of an airway problem is conditions like epiglottitis. Epiglottitis is the inflammation of the epiglottis. It's usually common in children. And when the epiglottis inflames, what happens is that the child will find it so difficult to breathe. Are you getting the point? So it can still be classified what as an airway problem. And also individuals that have cervical spine issue, because if you know about the cervical, injuries, any injury or trauma that affects the cervical spine is going to cause, a very not even. Let me make it just simple. Any injury that affects the cervical spine is going to, affect the brachial plexus, and that patient's breathing is going to be a problem. I get it. That patient will definitely need ventilating support. So everything's just going to get collapsed. I get it. So we still classify that as what an airway problem. Now, I just wish we have time. There are indirect ways. Nclex ask questions like this airway, cervical spines. There are a lot of things I told you that we have to explore, but let's just keep that coming. Now, what are breathing problems, right? What are breathing problems, class? You can see examples of the breathing problems that I was written down. Just few persons that have seen the image I displayed in the platform. Please, I'm displaying a picture on the Telegram platform, please. I'm displaying a picture on the Telegram platform. So if you're not there, please make our time to see the picture I'm sharing. All right. So breathing problems are, things that actually affect your patient's respiration. It could be in form of let's say someone is having okay, let me give you guys a particular this thing, not to stress myself. You have issues like individuals who are having hypoxia, intercostal retractions. These are things we see in children. Let me give you guys a flashback, just a moment. Still in the Telegram platform, just come there, you'll see us. Just come to the Telegram platform, you'll see the next image I'm forwarding. So let's look at this next image. See this next image right here. You have your okay. Yeah, these are quite examples here. You have anything that causes someone to have increased work of breathing, like in cases of paradoxical respiration, someone is having issues with their respiration in terms of maybe they drank opioids, it's causing depressed respiration. Also, let's say they had a fracture actually, a fracture to the ribs rather, a fracture to the ribs can cause one of the rib bones to get displayed and can cause, difficulty breathing. It can be a breathing problem. Are you getting the point? Are you getting the point, guys? So pneumonia, all those things can be, classified as breathing challenges, and there are lots of them. I'm just trying to beat time because this class is meant to last just for 1 hour. Then we are going to call on our recent test taker to give us our testimony on her examination, right? So that is that for breathing. Then what is the circulatory problem? Circulatory problem has to do with circulation. So if an individual is having issues with heart attack, like myocardial infarction, or an individual is having issues like um, they're having issues like ischemia, peritonitis. You can see there autonomic dysreflexia. These are spinal complications. There are a lot of topics that most of you are just seeing for the first time, and I just wish I can take out time to explain all these things. There's so much, right? Neutropenia with fever. Neutropenia with fever is just talking about individuals who are immunocompromised. Just imagine someone who's undergoing chemotherapy. Chemotherapy actually suppresses immunity. And when an individual who has chemotherapy displays symptoms of fever, we manage them as a circulatory problem because it can, quickly cause sepsis. Sepsis can damage multiple organs in the body. So we classify neutropenia with fever as what? As a circulatory problem. Do you understand? You get it? So these are the points you go through. Then after going through these points, the next thing you have to do is go to your outcome. That is the step 3 of what we are talking about. Step 3 is go to your outcome. Look at this thing. Look at this point here in our class. If you look at the image I'm displaying, go right there. You can go to the Google call. You see the step 3 is talking about outcome identification. I'm going to your outcome. Outcome is trying to, you have to reason. Ask yourself, I've selected my points. Does my points match the topic? Does my point promote the highest safety because Nclex is a safety examination and you shouldn't joke with that. I guys getting the point. So that is one of the things I want you guys to have at the back of the mind, right? So these are the simple things you need to know. Now, before I summarize, I want to tell us something. I posted a question earlier. I think yesterday. I posted a question yesterday, and that question was about I think that's a triad question. There's something most candidates fail to understand. If you're answering triad question, you have to, use a different strategy to answer triad question. Because the goal of triad, you can tell me what is the principle of triad in class? What is our principle when it comes to triad?
Sorting.
Right? What did you say?
Sorting.
Yes, sorting a patient that has the highest need for. Yes.
Yes.
Yes, our patient that our resources can actually help out, yes, within minutes and all that, right? That's the point. Now, I gave you guys a question. How you guys solve triage questions is totally different because in triage, we are talking about resources. We're talking about which, especially in cases of mass casualty, who are we going to focus? Those kind of questions, they have a different way, you address them, right? If you're part of us, there are a lot of things we are going to be explaining to you. Prioritization is not a question you just rush, once and for all. There are a lot of things you can always learn whenever you come across topics like this. Are you getting the point? So now, triage questions, they're trying to focus on the resources, and thank God it has a color coding system that helps us to know where to place our patients. And most of you guys did not get the right question. Most of you guys were picking option one, option two. This is question I posted. This was the question I posted yesterday, right? So we'll all come back to that, right? Because I think this class is going to have a part two, right? We want us to have a part two just in the case because it's not done. Mind you, this topic is big, right? If you can understand this topic, I think you will, you have actually covered a lot of things. It will give you a heads up on what to do. Nclex is not that difficult as most people think. One of the things that makes it that difficult is there are a lot of things you don't know. You are reading, you're not reading smart. You're not having the right strategy to do your implementation very well. That's one of the things. Knowing how to answer questions is very important. And I spend time teaching people how to answer questions, um, not even about content, right? Content is important, but you need to know how to make your content connection. You need to know how to talk about assessments of topics. Now, the other topics you've not assessed, if you look at our topic, our Google Meet image, you can see that we've not even addressed the priority clients. Now, what am I talking about the priority client? Priority client, let me give you guys a heads up. Priority client is talking about questions like I'm talking about questions or situations where you have multiple patients and they're asking you which of these patients would you want to see first. You can see the step-by-step process we have here. We have stable versus unstable, expected versus unexpected. We have the ABCs. Then you have acute versus chronic. You have actual versus potential. Now, why this point is very sensitive, there are a lot of mistakes people make. When they have said stable versus unstable, there are questions when they ask you which of these patients should they not see first. If they ask you that kind of question, that means they're looking for the most unstable patients. Do you understand? There are some other questions they can also ask you, and in those questions, they'll ask the question the way they'll formulate it. They will ask you which of the patients should the nurse discharge first. If they're asking you, okay, a particular nurse, let's say Nurse Oladejo wants to make a room. I'm using one of us in this platform. Nurse Oladejo or Nurse Jessica wants to make room for a new patient. They're not asking you which of these patients should you recommend for discharge. You see that in that sense, you're looking for the most stable patients to discharge. Are you guys getting the point? I said two things. One is for stable. If they ask you, a scenario-based question, actually, which of these patients should they not see first? They not give you a list of 4 patients. You're looking at for the most unstable patients amongst those, 4 patients. But if they ask you which of these patients should the nurse recommend for discharge, you can only discharge a stable patient. That is how to make a content connection. Are you getting the point? So in that question, you will be eliminating unstable patients and be picking the stable patient as your answer. That's the point. Expected but unexpected, that talking about outcomes that are, known to occur in some certain conditions, and outcomes that are known are known to be a complication. For example, if someone has surgery now, it's expected that they're going to be having pain, isn't it? Just like the previous question we did. Look at this question. Okay, if you look at this question, This particular patient, option number three, a client reports a dull aching pain at the surgical site rated at a rate of 6 to 10. Someone who did surgery is expected to have pain, isn't it? That's the point. Are you guys with me? Yeah. Someone who did surgery is expected to have pain. Are you getting the point? So what is the complication now? There are complications that you are not meant to see. Are you getting it? For example, after surgery now, you start seeing, let's say it was an abdominal surgery, you start seeing part of the organs protruding. That is a complication. We call it evisceration. In that case, it's an unexpected outcome. Do you understand? These are steps you take. Sometimes they can ask you for expected, sometimes they can ask you questions for unexpected. So you have to read your question very well. One of my candidates saw this question. I think, was it 2 months ago? They saw questions that you were asking them about expected. Are you getting the point? So that's the point. I'm just trying to write out the last point. Now the next one is ABCs. ABCs is just similar to what I've just talked about here. Right? ABCs, we talk about airway, breathing, circulation, just similar to what I've explained. And also we consider safety too. Safety in the sense of, in the case of mental health condition, we don't really prioritize those cases, especially if they are being brought up together like this. Now, safety in that sense, if somebody is having a threat to harm others or harm themselves, yeah, we can consider that. So we prioritize, we have to consider those options. Are you getting the point? Then acute versus chronic. Everybody knows that acute problems will take priorities over chronic problems. Do you understand? For example, a patient that has heart failure is expected, oh, sorry, heart failure is a chronic condition, isn't it?
Yes.
Isn't it, class? Yes. Heart failure
Yes.
is a chronic condition in some cases, yes. Then
Yes.
COPD, okay, let's use the one everybody knows. Chronic obstructive pulmonary disease. COPD is what? COPD is a chronic condition. Now, if you know that in COPD, there's what we call exacerbation of COPD. How many of us have heard about that before? So these are the things you look at for if you're answering questions. You check what are they actually testing before. These are the things you look at for. So acute versus chronic. Acute will always take priority over chronic problems. Do you understand? So if somebody is having just random symptoms of COPD, we don't really prioritize them like a chronic problem. But if someone who is having um someone who is having a chronic problem, so if someone is having an acute problem, a new onset of something, it could be a new onset of confusion, it could be a new onset of anything. So long as that thing is new, that is what an acute problem. And funny enough, Nclex can put it as the indirectly they can put it is a new admission of someone who has a particular condition. A new admission, because that new admission, there's a reason for admitting that kind of patient. I will explain that in our next class. Then the last point, actual versus potential problem. Now, potential is talking about risk. It has not happened yet. You cannot prioritize something that hasn't happened yet with something that's already happening. So no matter what, actual problems will always take priorities over potential problems that haven't occurred. Do you understand? I'm going to be rounding up the class by this information. Any question, class? Do you guys have any question?
No.
Right.
No
Now, I'm going
question.
to ask us, let me ask us, was, okay, hold on. All right. So let's just attempt one question. Um, Nurse Victor, are you with us?
Yes, I am. I am.
All right. Okay. Nurse Victor, please.